Welcome to 52 Questions. I'm Shannon Weber, Director of Hive. Every year, Hive answers hundreds of questions from patients, their partners, and providers. And each week in 2018, we're bringing one of those frequently asked questions to you in video format. If you have a question, let us know. We'd love to answer it for you. And for this week's question, I've come to Mission Neighborhood Health Center, which is an amazing community-based clinic that's several blocks from our Hive clinic. Mission Neighborhood Health Center has been a longtime partner with Hive in our work to bring safer conception options to people and have helped us with translating brochures. I'll let our esteemed guest introduce himself in just a moment, but this week's question comes from an HIV negative trans man who has an HIV positive male partner, and they're asking how they can have a baby.
So that's a great question. And my name is Neal Sheran. I'm a family medicine doctor and I work at Mission Neighborhood Health Center. I mostly do HIV primary care now, but I also see adult medicine patients as well. And so I actually just had two of my patients go through this experience, so I think I can speak a little bit to this topic. And so, so the first thing I wanted to say is that transgender people can absolutely have children, and they can conceive in different ways. And so the first thing to think about when you're transitioning and something to talk to your provider about is whether or not you want to have children in the future, because the medicines that you may be given, hormones, or medical procedures can affect your future reproductive ability. So it's something to consider before you go through the transitioning process. In terms of this particular case of a trans masculine patient who wants to get pregnant, so essentially what you need is the correct parts. And so you need a sperm and an egg. They need to be fertilized, and then they need a place to turn into a fetus, which would be a uterus. And so one important medical piece for transmasculine patients who want to get pregnant is thinking about the medications and hormones that you're on. So that's something that you want to speak to your provider about before you get pregnant. We know that testosterone is a known teratogen, which means that it can affect the development of a fetus. It specifically can masculinize a fetus, which means that it can make the fetus have more masculine features. And so it's something that you want to talk to your provider about, thinking about discontinuing before you decide to conceive. And the last piece of this issue is the HIV prevention piece, which is if you're HIV negative, there's important medical technology now to prevent HIV transmission. And so the most, I think, important piece to know is that if you do have an HIV positive partner, if they have an undetectable viral load for over 6 months, we have really good data now that they are not going to transmit the virus to their HIV negative partner. I believe there's other videos that go into more detail about that. There's additional options for conception as well, including PrEP and other technologies that we have that can even further reduce your risk of transmitting HIV. But overall, I think we have really good data right now that if the HIV positive partner has an undetectable viral load for over 6 months, they're not going to transmit the virus to their partner. So overall, I think this is something that's totally possible to do, and just might take a little bit of extra planning.
Awesome. Thank you for the good work you do, and thank you all for joining us. We'll see you next week.
Thanks so much for having me.